Pituitary gland. Pituitary gland, it has posterior pituitary gland and then anterior pituitary gland. The structure, it is very small, only the size about the 500 milligram. The location of the pituitary gland just beneath the base of the brain, behind the bridge of the nose, or lies in the hypophyseal fossa of the sphenoid bone below of the hypothalamus. Important of posterior pituitary. First one is important of posterior pituitary, as it is takes message from the brain and uses this message to produce the hormone that affect many parts of the body, including the stimulating all the other hormones, producing gland to produce their own hormones. For this reason, it is often referred to as the master gland. The main action of posterior pituitary gland. In the case of insufficient segregation of vasopressin underlies diabetes insipidus, a condition in which the body loses the capacity of concentrated urine. Another one is over segregation of vasopressin causes the syndrome of inappropriate antidiuretic hormone. The affected individuals excrete as much as 20 liters of dilute urine per day. First one is vasopressin. In posterior pituitary gland, two hormone it has stored. One is vasopressin, another one is oxytocin. Vasopressin it stimulate the kidney or arterioles. The function of stimulate the water retention, raises blood pressure by contracting the arterioles, then induce the smell aggregation. The next oxytocin, the main role of contraction of uterus, segregation of milk, the effect of urine contraction for lactation period. Then anterior pituitary gland, it is the size of P. The anterior pituitary gland, the front lobe of pituitary gland, which is found at the floor of the brain, called as stella dornicea. The anterior pituitary has some of the hormones secreted only in the anterior pituitary gland: thyroid stimulating hormone, luteinizing hormone, follicle stimulating hormone, growth hormone and prolactin. These are the hormones are mainly secreted in the anterior pituitary gland. Then important of anterior pituitary gland. First one is control the chemical and water balance in our body. Then control the growth and metabolism. Then influence the sexual behavior. Then stimulate the growth and maturation of gonads. Hormone of the anterior pituitary. First one is growth hormone. Mostly the target side, most tissues. Another one is tissue thyroid stimulating hormone, specifically to the target thyroid gland. ACTH, adrenodiuretic hormone, the main site for adrenal cortex. Another one is prolactin, it main function to the breast area. Another one is FSH for ovaries and testes. LH for luteinizing hormone, the target tissue for ovaries and testes. First hormone is growth hormone. To stimulate the growth of bones, muscles and other organs by increasing the protein synthesis. They affect the protein, fat and carbohydrate metabolism. Too little growth hormone segregation can be the result of abnormal development of pituitary gland. Next one is thyroid stimulating hormone. The hormone stimulated by thyrotropin releasing hormone from the hypothalamus. To inhibit 5-somatostatin from the hypothalamus, stimulate the thyroid gland to secrete the hormone thyroxine, stimulate growth and activity of thyroid gland. Another ACTH, it is stimulated by corticotropin releasing hormone from the hypothalamus. ACTH stimulate the adrenal gland to secrete the hormone called glucocorticoids. Segregation is regulated by negative feedback, suppressed when the blood level ACTH rise. Then prolactin, it also known as lactogenic hormone, stimulated by a PRH, that means prolactin releasing hormone from hypothalamus. incubate by dopamine from the hypothalamus, target cell